be mindful of everyone's time. My name is Jim Placus. I'm the Director of Technical Pathways with Volleyball Alberta, and also helping facilitate and manage the chat is Ray Sewell, our Program Manager in Calgary. So I just wanted to ask you guys just to take a quick read of the first slide here, and while you're doing that, just wanted to thank you for joining us on the call. We appreciate everyone taking time out of their busy schedule and to participate on this important discussion, and want to thank everyone for all their efforts working hard to navigate through the realities of operating within a COVID-19 environment. We truly believe in the power of sport and are committed to operating safely within the parameters set out by the Alberta government and Alberta Health Services. It's important to recognize that in the coming weeks there's a lot of unknowns, and we need to prepare everyone to be COVID vigilant this upcoming season. So just wanted to reinforce some of those points. And some quick introductions with our presenters, and we're real grateful and thankful. Laurie Eisler, head coach of the University of Alberta Pandas. Kerry MacDonald, Dr. Kerry MacDonald, if I will, Director of Sports Science, Medicine and Innovation with Volleyball Canada. And then not just Brock Davidiuk, but Brock Davidiuk, head coach of the University of Alberta Golden Bears Volleyball. So thanks to our three main presenters on this. Just a quick agenda, just a quick current state of where we're at. Kerry's going to go through some risk mitigation and mask wearing items. And Brock and Laurie are going to go through some COVID safety training things, as well as some discussions about their experiences using masks. And then we'll wrap things up with questions and answers at the end. So just a reminder, if you do have questions, please put them into the chat. Ray will sort through those, and then we'll go through those at the end. And if you have a specific question to one person, if you can mention that in the chat, that might help Ray manage that component of it. Excuse me. So just currently where we're at, the province is hitting record numbers with COVID, and we're kind of trending in the wrong direction from that perspective. And excuse me, just a quick look, new cases as of September 1st in Alberta, there were 166. And then, excuse me, as of November 17th, new cases in one day was 773. So you can see that significant increase just here in the fall. So with the rising numbers, it's likely that the current 2-week suspension that the government has put into place last Friday will likely be extended, even with further health measures and public health orders to manage the increasing numbers in our province. So really some behaviors definitely need to change if we want sport to continue. You know, we all have to kind of be leaders, take the bull by the horns and not get complacent with the guidance and prevention measures in place. Kind of feel that we really need to build trust in our communities, the government of Alberta, Alberta Health Services, and particularly facilities as well, that volleyball's taking every step possible to mitigate the risk of COVID-19 with our actions, just so that we can continue with sport. Another point is Alberta Schools Athletic Association, they had a committee together to examine rescheduling options for their provincial championships, and then they just recently announced that that won't be happening in the new year. They had a committee put together, and they recognized that there would just be too much conflict with multi-sport athletes and with club volleyball, of course, as well, but also with the rising case numbers that we're all experiencing. And just some reminders, even though that team training is considered a sport cohort, when we do get back to that, physical distancing should still be practiced whenever possible. So during breaks, prior to starting, at the completion of sessions, really whenever possible. Unnecessary contact between participants, handshakes, high fives, hugs, like that should all be strongly discouraged, and those are bad habits to get out of, because those have been common things. Our sports experience. Another really important part, and particularly as we lead into Volleyball Alberta and hopefully the facilitation of our mini leagues, are that coaches, referees, and staff are not considered part of a sport cohort. They are, when they're primarily physically distancing, using good hygiene, and wearing masks at all times, they won't be considered part of the sport cohort. So that's really important to note. Temporary interactions may occur, but those temporary interactions cannot be repetitive. It's critical when teams are participating in our, so this is critical when teams are participating in our mini leagues. The coaches must wear masks at all time, training and competition, and physically distance, so that they're not included in that mini league cohort maximum number. Our sessions are set up in teams of 4. So with a maximum of 12 athletes on each team, that's 48 athletes. So with the cohort number being a maximum of 50, coaches and staff have to sort of ensure that they're wearing masks, using good hygiene, hand hygiene, and primarily physically distancing, so that they're not included in those cohort numbers. Excuse me. VA we also will have COVID court managers at our premier leagues, and their role will be there just to remind athletes about some of those protocols to ensure people are physically distancing during those breaks, and making sure that we're meeting those guidelines and keeping things as safe as possible. We'd encourage teams and clubs to also have COVID managers to assist in those capacity with their teams, that they're following those principles and guidelines, and that we're all trying to keep everyone as safe as possible. We really don't want our sport to be the source of an outbreak, and safety and health of our participants is obviously our top priority. Yeah, so without further ado, we'll kind of move on to the next slide and with Kerry. So Kerry, you can take it away.
Sure. Yeah, and I'll kind of fly through a couple of slides and probably spend some more time on some others. So just kind of as a brief kind of review, obviously our sport requires the breaching of physical distancing in order for us to compete. So the reality is that we are not in a situation like other sports in which we can essentially reduce our risk dramatically down to near zero levels while we're competing in our sport. So that is just an inherent nature of our sport. We have breaches of physical distancing, and therefore we have the possibility of transmission within volleyball. Furthermore, our sport requires the sharing of equipment. So again, it puts us into a category that that is worse than some other sports, in that we have to have transmission, or we have to have sharing of equipment, and therefore we do have possibility of transmission through that shared equipment. And so obviously because of that, our risk can never be completely zero. The other thing I'll just mention is that we do have documented cases of COVID-19 transmission within sport, obviously, and I think you've probably all seen different that has occurred within sport. And we do have documented cases of transmission within volleyball. Primarily, at least the ones that I'm aware of, are actually not in Canada. They're European based, but we have national team athletes that have contracted the virus, I can tell you, in Europe. So it is certainly possible. Now, whether their contraction all happened on court or not, from the Canadian ones, I can tell you, we don't know, but we do know of documented cases of transmission between teams playing the sport of volleyball. And then obviously the last thing I'll just mention here is that our regional gathering sizes and physical distancing requirements are going to allow us to determine what is going to be possible whenever we do, come out of whatever lockdowns. And as we've now experienced within Alberta and across the country, is ever-changing restrictions. And we can probably anticipate that over the coming months, things are going to get better, and it's going to get looser, and things are going to get worse again, and things we might have to go back and forth. So this is a real challenging piece for us as coaches and as administrators, but we just need to recognize that we're constantly going to be going through these ever changing realities, and our protocols that we have in place are going to have to be adaptable, and things that we're going to have to be able to adapt them in fairly rapid manners when announcements get made and changes occur. So I think it's just important to recognize that whatever plans we have in place, we know they're going to change. So, okay, we move from there, Jim. Yeah, so just one thing on the kind of a risk assessment scale, and this is something that I had a presentation with Canadian Olympic Committee, and they talked about this quite a bit, is understanding that anything we do to mitigate risk is essentially kind of moving us along a scale between more safe and less safe. But what is safe in your context can have a lot of different variables. Whatever's going on in community transmission and the proportion of our population that has the virus is going to likely require us to increase our mitigating measures to make it safer within our population, right? And each individual that participates in our sport gets to set their own kind of threshold on what is deemed safe for them. Now, the reality is, as sport administrators, we're often setting what is deemed safe for our athletes. And we are setting that threshold. And I think it's important to recognize that, you know, that might be acceptable for some of your athletes, and maybe it won't be for others. And their threshold of what is safe requires more. And maybe they're not going to return, or maybe they want to do additional distancing measures or have different things in place. Whereas other individuals may feel really, really safe and not want some of these mitigating measures to be in place. So I think it's important to have this conversation with athletes, with parents, and recognize that the thresholds that you set within your environment is based on these kind of risk assessments. So I won't go through all of them, but I think just the last one that I will, as a transition, is just the use of masks, and understanding that if we use masks more, that is deemed going to be a safer environment. Whereas if we use masks less, that's going to be a less safe environment. So we can transition to the next slide. Yeah, so just really quickly, there's overwhelming evidence that, you know, COVID-19 is transmitted through aerosol-based transmission. And so we know that that is definitely a source of transmission, and there's enough, I think, scientific literature now that not a whole lot of people are refuting that. And then we also know that there's a huge body now of evidence showing that mask use is an effective way of minimizing the transmission, specifically the transmission from infected individuals to other individuals. There is more debate, I would say, around the protective mechanism of a mask from you actually contracting the virus. So that's a little bit more refuted, but it's fairly, I would say there's quite a bit of consensus around the effectiveness of masks at preventing transmission to other individuals. You can go to the next one, Jim. So this has been, now the use of masks in sport has been something that initially the World Health Organization, when COVID first hit, they came out with a statement essentially saying you should not use a mask while exercising, and concerns around both respiratory and cardiovascular responses. That said, the majority of literature that's now been coming out since then and throughout the summer and now here into the fall, more and more research is coming out really downplaying the concerns of mask use and exercise. The biggest concern is actually what's called dyspnea, which is a feeling of shortness of breath. So that is fairly well documented, and that is a common response that individuals have when they are using a mask while exercising. However, that sensation of a shortness of breath isn't often linked to actual changes in human physiology. So what we're not seeing in the literature, is not finding a lot of, is actually changes in what they call working breath, blood gases, or other physiological parameters. Even during really heavy and extreme exercises. So I've referenced a couple of papers there that if you want to read into more, and I'm happy to share more information on this. So for that reason, we do have reason to believe that it's fairly safe to exercise and to play volleyball with a mask. It's also likely even better because we are not technically considered an aerobic-based sport. So being an anaerobic based sport with more, shorter duration of intense activity, our breath rates are usually lower, and therefore the concerns are lower. The one piece I will just mention, however, is that not all masks are the same. So most of the research that's out there has primarily looked at like either an N95 mask, the disposable surgical masks that you were probably familiar with, like the bluish ones, or like cotton masks. And you may have seen recently that the Canadian Health Minister came out with a recommendation that masks should be 3 layers to maximize protection. There was a recent CBC Marketplace report that did some research on masks actually through the University of Toronto, and you can look that up. Anyways, there's kind of different levels of of masks on how effective they are at reducing aerosol transmission. Unfortunately, this is not looking at its effectiveness on sport, but bottom line is we don't have a lot of concerns, but I think it's just important to understand that not all masks are the same. Those that fit tighter to the face, we know are going to do a better job of reducing aerosol transmission. They are also more likely, however, to create that sensation of a shortness of breath with tighter fitting masks, obviously. All right, you can go to the next one, Jim. With us at the national team, and what we've been trying to do with most of our training centers is the big piece is being trying to keep COVID off our court. So obviously, if we're wearing a mask, we're doing this because there's a potential that it is in the court. But I think one of the most important things that we can try and do as administrators and as leaders in sport is trying to understand what our behaviors are outside of our sporting environment so that we don't actually bring the virus into our sporting environment, and our mitigation measures don't need to be checked or tested. So we're doing a lot with our national team athletes on recognizing that really trying to keep their bubbles really, really small. Now, I understand that this is even harder for us that are working in youth sport because they already have an educational cohort of some sort. Now they have an additional family cohort of varying size. And then they have a sport cohort, or I know in certain situations, multiple sport cohorts. So our goal is to try and keep these cohorts and these bubbles as small as humanly possible. And we know that the smaller this is, the lower the potential risk, as well as, and I don't mention it here, but just what our actions are. So we made the decision to not have our national team athletes traveling on public transit. As an example, we put a lot of pieces in place to avoid that from happening. It wasn't easy and it's not available for everybody, but that was one source of potential transmission that we were concerned with. So we tried to eliminate our athletes from engaging in that source. We also obviously encourage them from ordering groceries online and taking steps like that to get them out of grocery stores, only doing takeouts in restaurants, things of those natures to try and mitigate the potential transmission of the virus and therefore bringing it into our environment. The next one I'll just talk about is the importance of symptom screening. I think we've heard a lot about asymptomatic screening. When we actually dive into the literature, there's actually a lot of cases of what we would consider, it's actually usually more pre-symptomatic, is that they haven't yet developed symptoms, or what we call pausi-symptomatic individuals. And these are the ones that have really minor symptoms and feel like it's not that bad. My throat's just a little bit sore. It's not like I don't feel that bad, or my body's a little bit achy, but it's this isn't too bad, I'm okay. Those are the individuals that we really want to flag and try and keep them out of our training environment. Now, the pre-symptomatic, obviously at that stage of symptom screening, they're not presenting anything, we can't do it. But specifically those that have minor symptoms, we're really taking the mentality that if in doubt, just sit this one out. So don't come to training. And on the flip side, if we have known individuals that are going for testing because they have what we'd consider symptoms that would warrant testing, and we know that other individuals that are part of our training cohort are a close contact of that individual. So for the example, if it's a roommate or a parent or a brother or a sister that's going to get tested because they have substantial enough symptoms to do so, we are asking those athletes to also sit out training until test results come back. So even though they have no symptoms whatsoever, we're going to a higher state of caution, specifically in those areas where we know there's large amounts of community spread. And we have training centers in the Ottawa region, the Toronto region, and now in the Vancouver region that all have increasing amount of community spread. So this is a consistent piece for us across all of our national team training centers. All right, now kind of a bit of the dark and gloomy of what we're finding out about the virus. One of the big concerns right now is the potential increase of cardiac arrhythmias due to what we call myocarditis, which is actually just an inflammation of the heart or swelling of the heart. So one study major study that was published in JAMA out of Germany found that this swelling or enlargement of the heart was in 79% of COVID patients. So this doesn't seem to be a really rare piece. Another smaller study in NCAA athletes found that it was 15% of college athletes. So we don't know where it is. It's a very, very large variability between these two studies so far that have looked at this, but we have enough evidence to believe that this is a potential concern. The other thing that we're seeing with COVID is an increased risk of blood clots. And there's actually one documented case that I'm aware of anyways of confirmed death of a 20-year-old student due to blood clots coming back from COVID. So you can go to the next slide. So because of this, there's just, I want to put on everyone's radar the rationale around being really conservative if you do have an athlete that contracts the virus and is in a return to sport environment. So there's a document, and the link is in the bottom of this slide deck from the British Journal of Sports Medicine. This is from the summer, and it kind of outlines a bit of a return to play protocol. Now, a couple of things just to recognize, especially in our youth population, a lot of them are going to be minor symptoms or close to asymptomatic, most likely. So they're likely going to be quite eager to just jump right back in after their 2-week quarantine or after they get a secondary negative test or whatever the protocol happens to be in your health region. But I think it's important that we recognize that there's a real gradual, and we should be very conservative in this return process as we go through it because of that potential consideration for myocarditis and the potential concern around blood clots. So I won't go through all the points, and obviously I understand that the image here that you see, it might be too small, but if you do have an athlete that is returning from having the virus, I do recommend that you take some time and point them in the direction of this, and they likely should seek some additional medical advice before getting back on the court and returning back to your training environment. I think you can go to the next one. Yep, I think that's it for me. I'll let you guys take away.
Great, and then I'll just pass it off to Laurie and Brock here. Thanks, Kerry.
So we started this season not wearing masks in our training, other than obviously coaches and staff. And there was an outbreak at a U of A in a residence that shut us down for about a week. And how we were able to return to training was the university mandated that we wear masks. I think the way they termed it was as much as possible. And really, we shouldn't be doing anything if we shouldn't be doing things if we couldn't wear a mask. So that was the guidance we got from our university. And so it really wasn't a choice for us. I'd like to say that I was so smart and put the athletes in masks right from the start. But I was a little bit reluctant, and I think Brock would agree that it was, from a coaching standpoint, I can see it as not an easy decision to make, but having it made for us made it easier to adopt. And it was also adopted for all of our youth and club programming because they're directly affiliated under our varsity program. So the decision was out of my hands. Then every other decision was within my control. And so the first one was, what mask are we going to get? And at that point, we didn't know a lot about masks. I did the research that I could. I consulted with some experts, one in Spain, that's an exercise physiologist, and a strength and conditioning coach from the States. And they didn't really have much guidance, to be honest, because we just didn't know a lot. I did, actually, Melanie Sanford at the University of Regina, they were a step ahead of us. They had mandated masks right from the start in September. And she was quite impressed with the mask that they were using as a department. So we ended up ordering, we used the Under Armour mask, the sport mask. The reason why we went with it is because it seemed to me to be breathable. So they do feel a little bit of shortness of breath for sure, but it's 3-layer, and it doesn't seem to allow, the aerosols in or out. We know that for sure would at some point, but it seemed to be good quality. And the nicest thing about the Under Armour mask that I liked was that it's fitted. The mask is no good if it doesn't sit on your face. And the more that we are active on the court, and for coaches to be speaking with a mask on, really 2 things there. One is the fit, that it stays in place and they're not having to touch the mask all the time to adjust it. That leads to some hygiene issues. And for coaches not to feel, I don't know if any of you have had a type of mask. I had purchased one where when I talk and breathe, I feel like the mask is going right into my mouth and you're almost gagging on the mask. And the nice thing with this particular Under Armour mask is it sits away from your mouth. And so you don't have any contact with your, with your mouth when you're speaking or breathing. So it was really, you know, it was just a decision I made. We purchased it online. It was expensive for sure, but in a year where we're not spending a lot of money on much else other than masks, it seemed like a very good investment. We purchased 2 masks per athlete. They do find that when it gets wet, it's not as effective. So that's a problem. But when it gets wet, it gets heavy, and then it sometimes will slide down their nose, which then it's not as effective. So they have 2 masks. If they want to switch mid-session, they can do so. I got 1 per coach, and any staff member in our group, if they didn't like the Under Armour mask, they don't have to have that, but they must have a 3-layered mask. And that's just at the level of non-negotiable. If you're in our gym, you need to be masked and with a good quality mask. For our youth programming, we just ask again that people wear a 3-layer mask, and we do have disposable masks on hand in case they have any issues with their mask and they need to be replaced. I think that was about the extent of what I talk about mask choice, and I'll pass it to Brock.
Yeah, I think on the notion of mask choice, that article that Kerry referenced earlier, the CBC article, is a really good one for anyone to read. It talks about 1-layer mask, 2-layer, and 3-layer, and some that we should really avoid, like the gaiters or the valve masks. We started off the year with all of our athletes had a 2-layer mask from Stride Line that they could just wear whenever they wanted. Once we had the mandate come down, a lot of athletes chose that one. And then probably the most popular ones on our team are the Stride Line one, just because we ordered it ahead of the season. But Under Armour for sure is probably the best one that has been reviewed by our players. The other one that's popular in our gym is the disposable mask. These disposable masks, these ones are the blue ones. They're 3-layered masks. Now that we have this information and resources about the layers, we're trying to educate our athletes and our staff, and that's what we should be going with. And I think, just to Laurie's point, the 3-layer masks are fine to train in. We've had athletes training in them for a while, and if it's adding that extra protection, then that's something that I think everyone should seriously be considering. Mask hygiene is something that's been that was something on our radar when we got the mandate. I wanted to make sure that our guys were not adding this unintended consequence of being sick due to poor mask hygiene. Right now, everyone's trying, obviously, not to catch the virus, but there's other confounding illnesses that can make it look like you potentially will have the virus. And if we can limit that through proper mask hygiene, it just allows us to train more. And proper mask hygiene is just going to be good for us overall on this mission we're on. Some things that we have in place for our team is that you should have a casual mask and a training mask. So guys will show up to the gym in a casual mask. They'll wash their hands. They'll switch that into their training mask, and then they'll wash their hands again. That training mask has to be clean. It's part of our screen. When we go through our pre-activity screen, the last question we ask is if they have a clean mask. And educating the athletes on how to clean a mask, on transporting that in their bag, because it shouldn't be something they're just stuffing in their shoe. That should be transported in maybe a Ziploc bag, or even the Under Armour mask comes with a transporting mini bag, which is really useful. And we ask our athletes to be cleaning their masks every day. And to that effect, it's probably good to have 2 training masks. So the other one's drying, and you can have another fresh one for the next day. In part of our protocol is always water wash or mask wash. So anytime we're doing something around our face, we need to be sanitizing, doing that thing, and then sanitizing again. And this takes reminders. If you first start wearing a mask, everyone's going to be getting used to it, making micro adjustments. And it needs to be habitual that you're sanitizing before you do that and sanitizing after. So we're limiting any kind of spread that might be happening or bringing anything to our faces that might have happened. Laurie, if you want to go with our mask activities, I'll pass it back to you.
Yeah, so just talking a little bit about how we introduced the masks into our training context. Some things that we learned, or I saw right away, was the shortness of breath, and that either they aren't as fit as we're used to them being, given some of the challenges we have to our training environment. but the mask definitely made it harder for them to feel like they were getting air. And so elevated heart rates, we monitored both by just the eye test. You can tell when your athletes are gassed, but just intermittently during training, did a quick little heart rate monitoring, 10-second check to see what they were at. And even just playing a little bit of pepper, they could get their heart rates up to over 180. So it was pretty clear that they were working hard to get their air. And so what that meant for us is we don't want this year to be like the worst year they've ever had in their lives. We want it to be the best year possible given our COVID context. And so just trying to make it better for them. And so better means starting slow. We just started slow with simple drills, drills that were more low intensity so that they could adjust to this feeling of an elevated heart rate, even doing simple things. We monitored their exertion level. We gave them longer breaks between activities and more frequent breaks. So if it was something that was a drill that went for, say, 20 seconds, maybe they had a longer rest interval. Or if it was normally a 20-second drill, we would reduce it to maybe 10 or 15 seconds. If it was gameplay, we added a longer interval in between rallies so they could have a chance to recover. We added more timeouts so they could have a chance to just recover and reset. That lasted for a couple of weeks and they adjusted really fast. So now it's really a non-factor. I don't think we're factoring in anything around the mask use as far as the intensity of drills. We do have an allowance for athletes if they feel they need a mask break. They can go far away from anyone else in the gym, and we have the luxury, obviously, of having a lot of space. So they can get far away, get a little break by grabbing their mask and just getting some good fresh air under there, maybe going to their little station and wiping down a bit. And it's hot under that mask. I get it. It's hot for me too. But yeah, so it's for now they really feel like the mask is just part of their body and they're much less aware of it. Around coach mask use, it's what I see sometimes is coaches are really good about their mask wearing, except when they're instructing and they get kind of focused on what they're teaching or instructing or providing feedback. Then the mask might slide a little bit on their face because of just the action of talking. They need to be more vigilant. Coaches need to be more aware of their mask staying on their face properly, covering their nose and mouth when they're getting either closer to the athletes or when they're speaking loudly to the athletes. And so that's something that we ask, we have 5 or 6 coaches in the gym at a time, but we're very aware of one another and reminding each other to make sure the mask is in place. And just because the mask is on doesn't mean that therefore they can get really close to the athlete to give instruction. There's no need to do that. There may be cases where you need to interact closely, but we try to limit that as much as we can. And back to Brock.
Yeah, I think that's a point that I would like to reiterate as well. Like, we're big proponents of mask wearing, but that doesn't make us invincible to all the other protocols at all. It's really critical that we're still doing all those things. I'll echo Laurie in that we took it slow when we first started using masks. We kept drills familiar and simple that guys were used to. And it quickly was seamless for us. And there was one drill that I like to do for just a ball control and setting drill, and it gassed our setters more than it normally did. So that was one that I was able to shelf. And we're fortunate enough to have some monitors that were able to check things like Laurie's checking, like heart rate and some oxygen saturation stuff. And I think the biggest thing you can really do though is use your eye test and communicate with your athletes to see how they're feeling. And if you take it slow and give your athletes that chance to get used to the mask, we found that we could get right into our normal drills. Once that break-in period was over, we've been doing all of our normal drills, and the guys have been fine with them. That would be one of the biggest things I would want to say to everyone is that in our gym, we're able to play and train with the drills without it being an issue for our guys wearing masks. They're doing really well with it. And that's been great to see. I was skeptical of it at first, but our athletic director had this really important vision and mandate, and it's worked out really well for us. And that's a big thing for me that I want to communicate to everyone. Now, with the mask health, mask hygiene, and all this for coaches, for athletes, you have to give them regular reminders. It's just like if you're telling a setter to square to 4, you don't just tell them one time. You got to tell them 100 times. And I think you can approach that as a coach the same way when you implement mask use. You have to give reminders, and it's got to be consistent. It has to be updated, regular reminders. I still have to tell our guys to distance when they're coming into meetings to get instruction. Just like any other skill on the court, they're going to need regular reminders, and those reminders are going to have to happen often. Jim, we can go to the next slide now. One thing that if you are someone that videos your practice, that's a really good way to see how it's going. Like you can take a look at that video and see if your coaches are doing it, if your athletes are doing that, and you can even show that to them later. That's a useful tool if you are a coach that videos your practice. For just more of our general experience with our COVID safety and training, some things that we wanted to talk about are on the slide here. I'll start it off with talking about just how you have to reestablish your culture during COVID. There's some things that we've had to flip. And I guess I think the end goal you want with your athletes and with symptoms arising, and they could be small symptoms like Kerry outlined, you need to develop a culture in your gym where they're going to let you know long before they get to the facility. So if they have any type of symptom, they need to be texting you, calling you, letting you know, so that they feel confident, they feel comfortable that they don't need to come to practice, because they shouldn't be coming to practice if it's any of these symptoms. And so that flips a bit of our culture in Canada with volleyball, where I would say it's, if you got pre-COVID, if you got a sore throat or runny nose, you're normally going to practice. That has to be spun around 180, where we have to encourage the athletes to understand it's okay to stay home, and they should be staying home. And as coaches and administrators, we're going to foster that relationship in a myriad of ways, but that needs to be something that you establish. It's something that we've established with our teams, Pandas and Bears, where we really support athletes that communicate that to us early, and we try to applaud them as well, because if someone is not coming to practice because they got a runny nose, that needs to be looked upon as something that is socially responsible. And promoting that culture where we are right now, I think, is really important, because before that, we have athletes coming to the gym if they have a runny nose, or maybe they're toughing out a painful knee or something like that. But now is not the time to be toughing out any type of symptom. This absenteeism piece, I think, is an important thing for everyone to also try to integrate in your culture. So even if an athlete isn't able to communicate to you on time, or if a coach isn't able to communicate to you on time, having them feel the freedom to not come to practice and that be okay is important, not just for the athletes, but for the coaches. And what I've found as a coach running an environment where we have ample staff and guys that are able to run a practice, if I'm feeling something, and I have stayed away from practice with symptoms this year on several accounts, as a head coach, you have to feel free to cancel practice or stay away from the gym. As those symptoms arise, it could be difficult for any of your staff, or if you only have 1 or 2 coaches, that could be difficult, because then who's going to run your practice? But right now, that notion of absenteeism and cancellation is a very important and critical choice that you might have to make if you as a staff begin to feel symptoms. Laurie, you want to take over our protocols?
Yeah, and so in order for us to return to campus with our teams, Brock and I both had to complete a very, very comprehensive document that covered everything imaginable, actually lots of things that were not imaginable because of COVID. So what I recognized pretty early in the spring, and actually when our national championship was canceled in March, is that COVID is now our master. Yes, I have an athletic director, but our real true master is COVID right now. And COVID's going to dictate what we can and can't do. So I'm giving up that kind of control and power is really hard as a coach. We all want to be able to do our season plans. We all want to be able to do, a monthly, a weekly, even a daily plan. But what we found really fast was the plans are going to be so dependent again on what COVID dictates. So we do need to have protocols. And I think really like what Kerry said earlier about keep COVID out of your gym. So that has been our primary focus for our team. Is our number one goal for Pandas volleyball is to stay COVID free. So our protocols are built around that. What does that mean? It means that we have to think about everything from really the moment a member of our team leaves their home to head to practice. So that's the moment of screening. So they self-screen at that point, right through the entire training program or training session to how do they leave at the end of the practice and how do they conduct themselves leaving the building. So it is kind of opposite year, things that we would normally do, such as if not a rule, but a guideline on our team is if you're not 10 minutes early, you're 5 minutes late. Now it's people show up as late as possible. We want you at the gym for the smallest amount of time possible. So they're coming in maybe 5 minutes, 10 minutes before the scheduled practice time. And we might not even start on time because we're not going to skip any of the steps of doing their screening when they come in and checking in with them and giving them their chance to, to get mentally ready for taking on the practice session. And we want them out within 5 minutes after practice. So they have some cool down time for sure, but then they need to leave and they need to leave the building. They can't just hang around and spend some time socially. Any meetings we're going to do virtually. We're not having any in-person meetings. We're trying to keep them always apart, which is weird in volleyball because we always want to come together in volleyball. And now it's opposite year and we want to stay apart as much as possible. Even something as simple as the first 2 weeks, I spent more time practice planning than I ever have in my life. And it was things like, who should I partner up in warm up? And rather than taking the 5th year athlete and putting them with the 1st year athlete, I'm taking the athletes that are already close contacts and having them partner. So roommates are partnering together because they're already close contacts. And so things like just all the thought that needs to go into absolutely everything you do in this COVID context is so critical in helping to keep COVID out of your gym and then not allowing it to transmit within your gym. What we don't control is the 22 hours a day that the athletes are not with us. And we're very aware that even if they do everything right in their personal life, anybody can get COVID. It's shown and we see the numbers. So we're not so naive to think that it's not going to come in, but if it is get in, we don't want it to transmit. So that's why masking, distancing, hygiene, sanitizing. If I had a nickel for every volleyball I've wiped out since July, I'd be a rich person right now. And then the symptoms monitoring. So needing protocol around all those things. And I guess I would come back again to what Brock had said earlier is the best laid plans, your protocols and your practice planning are only as good as your implementation. And when we're coaching, sometimes we can get pretty focused on, the athlete and the skill and the tactics and the things that we really are passionate about. And we may not be seeing some of those other things that are happening. So a video would be great feedback, or if you have someone that you trust that you could have come into your gym and just observe the procedures from a COVID perspective, it would just be great feedback for you as a coach, because ultimately, you're responsible and you have to ensure that what you have set up for your athletes and your team is reducing risk as much as possible. So I will pass it back to Brock for team orientation.
I think one of the best ways to do that is to get everyone on the same page before you're starting your season of training. So having a team orientation, a mandatory team orientation over Zoom or something like that, that's what we did. All our staff, all of our athletes had to be on that call, and all of our parents were allowed to come too. And I think getting everyone on the same page, understanding the protocols, making sure they go through the Volleyball Alberta protocols, and then explaining a bit what your training environment is going to look like and changes, and setting those expectations early means that you can have as small a window as possible for the break-in period, because each minute, each hour you're on the court is going to count towards this virus possibly entering your gym. And if everyone's on the same page ahead of time, that can be a really powerful tool. So I would encourage everyone to really think about having a team orientation mandatory before you start. The monitoring symptoms piece, we have the screening tools. You've seen them on Volleyball Alberta. We have our versions of them at U of A. We do them when athletes and coaches arrive to the court. We're doing that screen. That should be the final check. It should. I'd really recommend that everyone have some sort of screening or communication platform in place, that if someone has a symptom, that's being communicated to you long before they get to the facility. Because we don't want someone coming into any gym that is symptomatic, and that's when you find out. Now, it's likely the case where athletes, Kerry had mentioned that we have some national team athletes that have gone through the virus. There's, of course, going to be so many athletes that have symptoms that maybe don't end up being the virus. When that happens, if you're lucky enough to be part of a program that has a COVID person or a COVID manager, then you'll have some guidance there. If not, it's going to be the safest thing to defer to the AHS screen. We're really lucky that we have an amazing COVID manager at U of A. A lot of the times what we're talking about with him is that we're referring to what the AHS screen and recommendations are. I don't think it's a good idea to slip into that zone of anyone who's not qualified to be diagnosing or giving medical advice based around symptoms. So if you're a COVID person or manager is there to help with that process, they're there to track symptoms and to support the AHS guidance. I think that's an important piece when we're thinking about what happens when we're symptomatic. One of the things that's been valuable for us and all the teams at U of A is keeping a log. Laurie's system has a screen and a log together in the same place. We have a screen and a log in separate parts, and that log is really important because if there happens to be a case of close contact or an actual case on your team, you're going to have that log ready to go and ready to give to AHS in case to help with their contact tracing. And we know in Alberta that's an issue already. So if we can do our part by having an updated log through something that can be as simple as a spreadsheet or Google Sheets or Google Forms, I think that's a really good piece of your whole process. As Laurie said, she spent a lot of time, seasoned vet, writing practice plans and coaching a season. She spent a lot of time recrafting how she did that at the start of the year. That's time we're going to have to appropriate as coaches away from maybe running a drill to making sure our drill is safe. Laurie, if you want to finish this off with any blind spots you can bring to the forefront.
Yeah, and I want to come from a place of really understanding the challenges. We have different challenges. We're in a pretty privileged situation being at an institution with tons of human resources and knowledge and people supporting what we do. So I understand that we have the best people in our sport. Volleyball people are the best people around, and I know people are very well intentioned. But from what I've observed, not only in our gym, but in other gyms, is I think sometimes people just don't see what is happening out there. So just some examples, again, coming back to wearing masks, coaches not wearing the mask when it's most important to do so. So when they're in proximity with the athletes or when they're wanting to talk loudly, they need to have their masks on at that time. I'm seeing teams that are huddling for instruction. So breaching physical distancing, breaching that 2-meter distance because they're getting instruction. They need to, that's not a time to come within 6 feet of one another. A case that was a concern for us in one of our camps is gathering at the ball cart. So you set up a drill and then you want them to go get a ball. If they all have to come together at one ball cart, again, that's unnecessary gathering. Have a system in place so that they can get the ball without all having to go to one place or returning the ball to the same place. Huddling on court during team play. So they, of course, that's their normal pattern is they come together after a rally and they, you know, the cheer, whatever they do, they need to stay 6 feet apart. No high fives, as Jim said, no other physical contact between the athletes or athletes and coaches. Athletes that are waiting outside of the court for their turn in a drill are not distancing enough. Athletes not distancing when they're having their water breaks. I'm seeing drills, and it's happened in our own gym, where drills that require proximity or breaching of physical distancing that are really unnecessary drills. You could redesign that drill so that distancing can occur, or just throw the drill out and save it for post-COVID. And then this one always gets me because we're so concerned about sanitizing our volleyballs in a place like Saville, where you have other groups in there. If the ball from another court comes to your court or another group comes to your court, don't touch it with your hands. Kick that ball back and return it to them without having any of the foamite shared between groups. And for us, if somebody does touch a ball, that is our ball, it goes immediately into the sanitization basket. So again, I don't think that anybody's intentionally trying to sort of not see these things or make these sort of breaches in protocol. I think sometimes coaching is a really big job and it's hard to be aware of everything, but the protocols are only as good as your implementation. So make sure that what you plan is actually what you're doing. And I think that's it, Jim.
Okay. Perfect. Thanks, guys. So we'll just take the next 10 minutes here. So if you do have a question for either Laurie, Brock, or Kerry, or potentially even myself, please type them into the chat and Ray will work through those. And as that process is currently happening, I will let you know that Laurie and Brock have got some assistance from the U of A, and they're going to be videotaping some components of their practices and whatnot, just to see what COVID practices are in place, what they're doing, and then that video will provide and will post so that can be viewed and shared with clubs and whoever else. So just to be aware that they're just producing that, and we would have been great if we would have had it available for this session, but it will be coming in the next week or two once they're able to wrap it up. Was there anything on that that you guys, Laurie or Brock, wanted to mention, or no? So I do want to thank the U of A for going out of their way to get their people together to get that video started. So that's great. Ray, if you have some questions coming in and can direct those, that'd be great.
Jim, first one's for you. Will Volleyball Alberta be recommending or making it mandatory to use masks during tryouts and practices?
Yeah, this was phase one, so we're at the very beginning, just looking at the information, and there were some conflicting information. So we'll definitely be reviewing that, and that and I think provided that all the information indicates that for competition and for training, that seems like the safest avenue to go. I could see that going forward. So we'll likely be reviewing this information here and making a decision shortly on that.
How is U of A enforcing protocols if people are relaxing on them?
Laurie, you want to take that one?
Sure. Well, I wouldn't say that things are being enforced. What does that mean? We are instructed in how to do our jobs right now, which is to train our athletes with masks on. Does that mean that everybody's doing that 100% of the time? I have no idea. My focus is my team, and I believe that we are in an environment of trust where our coaches are trusted to do the right thing and follow direction. I think there has been some resistance, and some sports may have a harder time implementing the mask mandate than others, but I'm the volleyball coach, so I'm paying attention to the volleyball team, and you know, following the direction of our university. I think one of the reasons why we were able to continue during the team sport shutdown is that the government believes that our safety procedures in place for university are very good. Like, they feel that we're safe, and our university certainly feels we're safe. And I want us to be safe. So it's pretty easy to follow the guidelines if it's in line with what your own philosophy is.
Yeah, we have had areas that had in the varsity environment that were flagged and dealt with, and protocols improved because it's a fluid scenario. There have been some checkpoints, but we got a lot of varsity teams, and I think, yeah, we don't have a task force that's enforcing everything, but I think part of the communication from our department heads, and then I would want to say to everyone else, is the social responsibility piece again. I think that's really on us in our silos to make sure we are doing what's socially responsible. And for me, like, I grew up playing all sorts of sports, but I stuck with volleyball because I love the people and the community in it. And I think it's such a great sport. I don't think it's better than any other sport. I just want to speak to my experience. I think there's great people in volleyball. And I think now is the time for our great people to be socially responsible. Volleyball Alberta is not going to be able to police all of our clubs across the province, but I think all the clubs should be taking that social responsibility piece on themselves to do what's right, so we can be doing volleyball in a safe environment and not try to sneak past any policies, but try to create social ambassadors in our youth that are playing this sport in hopes that we can do our part in keeping transmission low. Ray, I think the next question was about like what we're doing for best practice, keep equipment sanitized. We have a distributor that outfits us with sanitization, or hand sanitizer and equipment sanitizer. In the summer, Laurie and I, before we had the opportunity to have that coming in through the U of A athletics department, Laurie and I had our own camps running where we were using our own sanitizing materials and fluids and all that. You can go to Canadian Tire and get something like Spray 9, which is available at a lot of stores, and that is very similar to the stuff that we use on court. Before any session, even though Saville does it themselves, we'll spray the nets, we'll spray the posts, we'll spray the cranks, any high touch areas, the whiteboards. Then we created what we have is a clean bin and a COVID bin, so that our balls are all cleaned ahead of time with something like Spray 9. It's been fine for the Macassa balls, no problem on the material there. Wipe those off, put them if it's at the end of a drill or whatever period of time we've decided to clean the balls, then we have that dirty bin, and then we clean all those balls, put them in the clean bin, and make sure we're cleaning those two bins separately, and creating some type of protocol that works with your drill design to clean the balls periodically, I think is a good thing to be doing. We also purchased a bunch of sanitization pumps to put all over the gym, so that athletes have readily available access to them, so they can be doing that very, very frequently throughout practices.
Thanks. Jim, the next one's for you. How can you say coaches in future VA competition game situations are not part of the cohort because they're wearing masks? According to AHS, even if a coach wears a mask and there happened to be a positive COVID-19 case in a foreign team competitive cohort, everybody would have to isolate.
Yeah, it's more of the guidelines in the sport recreation and physical activity guidelines when they're speaking to mini leagues and cohorts that provided, once again, coaches are wearing a mask, they're primarily physically distancing. So they have to be physically distancing basically at all times. They do account for the fact that there might be some isolated instances where you're coming in close contact, but those have to be brief, short, and not repetitive, and then also using good hygiene. And that's just so that they're not included in that group of 50 numbers, so that referees or coaches, they might referee or another mini league, or that coach might be a coach in a different sport, I think is why they sort of created that concept. But those premises need to be maintained, which is pretty important. And it's the physical distancing thing, and primarily physically distancing at all times is a key component in addition to the mask wearing. So those are the guidelines that that the government's provided as part of the mini league and cohorts. Well, we are nearing our time, so I just wanted to say thank you to Laurie, Brock, and Kerry for their time. Really appreciate their expertise, and thanking everyone here for jumping on this. We will have this session recorded, and it will be published on our website, in addition with the video and a few other resources that have since come through. Just as additional resources. And then other than that, Kerry, was there any other final message, same with Laurie and Brock, but I'll start with Kerry, that you wanted to give to the group before we sign off?
No, nothing from myself. I see a couple of comment or questions around just in hand, like around literature, I think, and some things on that nature. Feel free to email me, and maybe I don't have my email address up here, but I'm happy to share kind of the literature, and I've been kind of collating literature as I receive it as well. So I'm happy to share what we're finding specifically around mask use and anything else around kind of the return to play items. So I'm happy to share my email address. It's kmacdonald@volleyball.ca, and I'm happy to share.
Great. Brock, any final messages before we sign off?
Nope. Thanks for having me.
Laurie, I'll pass it to you.
Yeah, well, I think I'm going to speak for Brock as well, that we're more than happy to be here as a resource to help the community. And it's a really, really tough time, but you know, volleyball can still be played, I think, through these difficult times if we're willing to make the adjustments and you know, follow protocol that keeps people in our community safe.
Perfect. Yeah. And I would just, that was my finishing message, is as long as we're vigilant, we can hopefully continue on with providing sport, because we do believe sport and volleyball, obviously in particular, is really critical for everyone's overall well-being. So we just want to make sure that we can move forward with some form of a season. So once again, thanks everyone, and appreciate your time. And we will be posting this information and those videos when we do receive them. Thanks, and have a great week, everyone.